on there. All right, let's get going with this. I'm Elizabeth Johnson. I am representing NMAPA today, and I want to talk to you about the blizzard season that's coming. And this is something that we go through every year. You go through it whether you're in medication specialty access or whether you're working in a hospital or a private practice primary care. Everyone goes through this season, and it affects them in different ways. So before we get started, I really want to put out there that we do have a Q&A session at the end. I think that's the most valuable part of this. So if you can shoot your questions through the chat, they're going to read them out and I will answer. And that way we have a recorded list of all the questions that we can put together and send out later, or give us topic ideas for future conversations. So again, throw your questions in that chat. This is kind of a high-level Cliff Notes version of our Blizzard toolkit that we put out. So if you don't have a copy of this, I strongly recommend run out, download it, get yourself a copy. This is several team members' hard work put together, and this is what we live by. This is how we prepare our personal jobs, friends in other places. This is what we pass around. This is how we do our best job to support our patients, number one, but to also support our providers and support our other staff members. So take a look at it. There's a checklist. There's things you can put in place by month, which we'll also go over in this. That patient letter, things to talk to your patients about, that's in there, as well as some posters, some signs you can put up around your facility or practice that really engage the patient in updating you and talking to you about what might be changing. So let's get this going. What is a blizzard? And you know, it's not snowing where I am in North Carolina, but at work, there's papers coming off the fax machine every day, which is kind of where this term has come from. But what happens this time of the year is insurance plans start changing. The option to start changing is there. So usually that kicks off October 1st. And what can happen at this time is patients, if they've changed jobs, this year with COVID and job loss and pickup of Medicaid or other plans, this is a time that's a little disorganized. Patients may not be sure what coverage they have or will have. So when they come to you for an appointment, an injection, infusion, they may not know exactly what's going on. And so for us, that's confusing because we don't want to render services not knowing if that patient's going to be covered. So delayed access, right? On top of that, if the patient doesn't have coverage, how are they going to get their medication? How are they going to see the providers they need? What are we going to do? It's the end of the year. Our funds open with different programs. How can we get them support from that? So it can be really chaotic in making sure that our patients have coverage and that they're going to get their therapies. The benefit designs change. Deductibles typically roll over January 1st. There are some plans that change at other times of the year. October 1st, November 1st, you even have some that change in July. So preparing for that, looking at what's coming, talking to patients about what their health looked like for this year. This is a different year, right? Not everybody went to the doctor like they normally do. They may have gone and went to the ER. Maybe they've hit a deductible because of COVID testing or whatever that may be. So talk to them about that. Is their deductible going up? Are they going to need more support after January 1st? And the other thing to really watch are policy changes. So even the patient who said, oh, this injectable was covered. Well, maybe next year it's a carve out to a pharmacy. Maybe next year it's no longer on formulary. It's no longer preferred. So it's really important to start looking ahead to see if a patient's going to have to change. With patients not coming into the office as frequently right now, it's very difficult to have solid clinical notes to be able to send in for formulary changes, medication changes, if you haven't seen the patient. So we have to think an extra step ahead in how can we have that conversation with a patient, a reliable, documented conversation to provide to that insurance. I've heard a lot of buzz going around in the news about the cost of healthcare changing next year, increasing. That will trickle into other things such as tier changes and things like that where some of these medications fall. So 2021 should be pretty interesting. So this is the sum of the blizzard, right? We got to prep for what's coming. Things are going to start changing. It's also the reverification season, right? You're going to need to look at enrollment forms from manufacturers. I know personally at my job, we get a list of patients from our main medications that we give, and we need to go through and verify that they're going to stay on therapy and utilize those manufacturer resources to also help us make sure their benefits are not going to change. So that's another part of that blizzard piece. What does it look like? So it looks different everywhere, right? If you're in a facility, maybe you're not the one where the phone lines are ringing to. If you're in private practice and you're working the front desk or you're that point person, your voicemail box may be full. In my case, I work off my cell phone and it rings 24/7. So patients calling, other practices calling, insurance companies calling, they're all trying to reach out and start working on these things. Patients with last-minute insurance changes. This is where it's really important, if you haven't had that discussion yet, of how you're going to check before a patient comes in. And we'll talk about that some more in a little bit. Schedule gaps. If you have downtime in a practice or a facility, as an advocate, there's always something to do, right? There's always some PA I need to call on, or there's always, you know, follow-up to do, refills to do. So look at your schedule gaps. Could you go look at copay assistance? Could you spend time looking here? I know we're all multitasking professionals, but use those gaps wisely. Delays in patient treatment. What can happen a lot going into the holidays is not only the insurance part of this, but patients travel, patients aren't coming in. Really look at your schedule and when your patients have been in last, and make sure you're keeping them on the closest to a normal schedule as possible. Call, use your portals, text reminders, whatever you may have. Longer than usual hold times. This makes me kind of giggle. I called a plan yesterday, and that was a recorded message, is that we're experiencing longer than normal hold times between August and October. I was like, well, that's kind of misleading because it's going to be longer between like now and April. So, but you know, kudos to them for at least being somewhat transparent. And patients that don't notify staff of insurance changes. This happens commonly, and it's not the patient's fault. We like to blame and we like to get upset, like, oh, you didn't tell me. But think about how long it took us to really understand all the parts of insurance. I didn't come out of nursing school knowing what an HMO versus a PPO is, and you know, I had no clue. I learned on the job. So opening the dialogue, opening that conversation with patients early, now, yesterday, whenever you can, will help that, and will kind of build that connection with our patients and help them feel supported as part of their healthcare team. So open that up. Whatever channel you have to get in touch with the patient. Again, there's now portal services, there's text reminder services, there's email, phone calls. Change your voicemail at work. If you have an automated system, change your automated system that constantly reminds patients, hey, we're here for you. If you don't know, we can help you. Let's talk to you about it. And these are some questions or ways you can ask differently to kind of provoke that thought. If you just ask, have you received a new card or has your insurance changed? You're not always going to get the response you need. That may not trigger something that changed for a patient, especially now. Some insurance plans don't even send out cards. It's through an app. It's electronic. And they may not have that. Maybe it went to their partner. Maybe it went to an old email address. So let's ask. Let's also talk about, have you changed jobs? That's going to be a big one this year. Did you pick up a marketplace plan? Do you have a new Medicaid ID? Just ask the questions. And sometimes it seems like we're bombarding a patient, but if you're upfront and you're honest and you explain, hey, this time of year is really tough and we want to make sure you're covered. We want to make sure that we can deliver the highest quality of care to you. Please let us know if anything changes. I'm a big fan of posters, even just little like short printouts. The one that's in this Blizzard guide has a stop sign on it. That's pretty attention grabbing. There's also one that we have that has a picture of an insurance card, and sometimes they get United Healthcare, for example. The card looks the same, but the ID number's changed. So even if you got a new card in the mail and it looks exactly the same, please bring that to us. We need to scan that in once a year anyways. Just let us know. And I really like the patients that volunteer, that call ahead of time. Hey, this is going to be my new insurance on January 1. That's great. I can put it in the system. I know it's there. But still, please bring that card in January 1. The last one, did you change your Medicare plan during open enrollment? This is a new area to me, and we actually have a member of the DMAPA team who's highly skilled with Medicare. And this is something that I'm learning as we go, and I've learned a lot, and I appreciate that. And talk to your patients who became Medicare eligible or may have changed. Maybe they went from traditional Medicare to an Advantage plan. You're going to need to know those kind of things. So even if they're thinking about changing, a lot of times, especially find it in the Medicare demographic, they ask us, hey, what kind of Medicare should I get? And while that's not my job I'm not an insurance broker, I'm not a Medicare counselor, I do appreciate that they come to us, and I just politely remind them, hey, if you change or whatever you pick, just call and let me know. That's a great thing to do starting in October. So the best thing to do, say a patient has changed, or say a patient knows ahead of time, right, that something's going to change. Before you do anything in the month of November and December, especially January, double, triple, quadruple check that the PA you have, that prior auth you have, matches the insurance you have. If the patient's changed and your prior auth is not under that, that's not going to work very well. Make sure that critical patients have been scheduled prior to the new year. You want to make sure your treatment plans are up to date. You want to make sure that if an insurance company requires updated medical records, you have those. Again, this is an odd year. You may have to have a telemedicine visit, but make sure that depending on what's required, whether it's telemedicine with phone only or telemedicine with visual, so Zoom, whatever platform they're using, is documented. The patients are re-enrolled in their copay assistance or free drug programs. This is that part of the blizzard season where the manufacturers will reach out, send you lists of patients, and work with you to check that verification. The way I do it is different than what other practices may do. I have quite a large volume of patients, and I have a whole team who I work with that we pick a day and we sit in a room and we go patient by patient. We keep our reimbursement managers on speed dial, and at any point, if we have questions, need them, we're tapping into those resources. For smaller practices, this may be a day you knock out all of your medications. Whatever that may be, take the time, do that. I know sometimes those faxes come over and we file them in the corner, but I promise they have benefits. Again, collect insurance cards. My favorite is when the patients give you their medical card, a pharmacy coupon. They just give you everything. And there's no harm in that. I'd rather have too much than not enough. Start checking expiration dates on your inventory. This was something we ran into a couple of years ago. A drug changed the way it was packaged, and the first ones that came out expired like December. And so, we're thinking, okay, we've got some stock going into the new year. Not true. So really make sure that all of the medications you have on hand are well within their expiration time. Rotate your stock. If you've got some stuff about to expire and you've got some PAs that are about to expire and patients coming in, prioritize, right? Have those medications used. This is buy and bill we're talking about here. So office stock, have those used, get those expiration dates out. We want to try to minimize losing money or having to rely on replacement plans. We want to use what we have. For your specialty pharmacy drugs, if those expiration dates are coming up and the patient's not coming in, or they just won't make it by that time, please reach out to those specialty pharmacies and let them know. They will either contact the manufacturer or have you do it, but at least that SP knows that the expiration date is coming up on that drug and that you're going to have to either replace it or something needs to occur so that patient can continue treatment. One that I like to touch on too is EpiPens. I come from allergy. Always check your expiration date of your EpiPens. There's nothing worse than going to a family member's house at Christmas and your EpiPen's expired. And then additional resource from manufacturers or DMAPA. So our goal as an organization is to be here for the advocates, to be here for you who are doing this. So if there's something that we can help you with, maybe we have a toolkit, maybe we have a connection, We're here to help facilitate that as well. And then your manufacturers, your sales reps, your reimbursement managers, your CAMs, there's so many different titles, but rely on them. They want to help. And especially after this year, I think they're ready for connections too. I know I've thoroughly enjoyed talking to all my different representatives, so please reach out to them. Kind of to finish through October, I know tomorrow's Halloween, so this might blend into November a little bit, but develop some policies and procedures. Say on January 1st, this is going to be our policy. Before every patient come in, and this is an example of what I use in our practice. This can be adapted to fit your needs, but eligibility and prior authorizations are checked at least 2 days prior to appointments. Some people do a week. That gets a little far out for me. I like to know right beforehand. If that authorization is not valid, we always call the patient and let them know, hey, this is what's going on. We're working on getting this done. At that point, if it's critical, we will expedite. If not, we will reschedule that patient. Change those appointment reminders, voicemail. Again, we talked about this. If it's changed or will be changing, make sure you update your systems. There's nothing worse than scanning in that new card and then not following through on that update. And if that's not your job and that's someone else in your office, tag them in, communicate. Sometimes patients go through the front desk and then get back to me in a shot clinic and say, oh yeah, I got a new card. Walk them right back to the front and say, hey, let's get this info in. And then anything that's going to affect a patient, say if you get new insurance and you don't give it to us the day of your appointment, we have the right to reschedule. Whatever it is, make sure that you're alerting patients in plenty of time. If that's something that's going to impact your January appointments, call them in December, let them know. The worst thing is an angry patient because we didn't give them the information. And it's hard to hold patients to policies that they had no idea was going into effect. So communicate those policy changes. Getting into November, open enrollment starts for employers, Medicare, Marketplace. If patients are changing or have changed, again, they're going to come back to you or should come back to you. Keep asking. If approved, review all those policies and procedures with staff. It's not fair if clinical staff know, but administrative staff don't know. Make sure that you host a meeting, you do something where that can be clearly communicated across all members of your practice. And I love to go to my providers and my physicians and say, hey, this is what we're doing. I need you to back me up on this. If a patient asks a question or if a patient talks to you about it, this is the stance we're taking. And usually that teamwork, it sounds like I'm backing my provider into a corner, but that teamwork really helps. Patients will sometimes ask the provider for a free pass or, oh, can I just sneak in one more time? Or just, we're a team, right? Again, start notifying those patients and the effective dates, complete your reverification paperwork, and then contact patient if they're required to reapply. So in some situations, we can do the work for the patient, we can re-enroll them, we can do that kind of stuff. And in other cases, they have to provide financial information, things like that. So really communicate with that patient. Going into December. So December is when open enrollment closes. Depending on what that employer plan looks like, it may go into the middle of December or stop at the beginning. Keep asking your patients every visit. If you want to get proactive, look at that January schedule, call, reach out to them. And I think at a specialty like mine, we see our patients pretty frequently, whether it's allergy injections or specialty drugs. But looking at others, primary care, some of the other specialties where patients aren't receiving medications, but they're still coming in maybe every 6 months, really take that unique opportunity in this time to bond with that patient. They will appreciate you reaching out, things like that. Ensure that your staff are reminding patients and asking patients. Make sure that if any signs you've put up, they're not falling apart at this point, they're not torn down, they're not looking sloppy. Make new ones, put them out there, keep them looking fresh. By now in December, you should have already submitted all your reverification paperwork. If you haven't, the manufacturers probably aren't happy with you, but please make sure you get those in. And December is also the time that I like to go through and set goals. I know this isn't in here, but it's important to set goals for what good looks like for the next year. It's important to talk about how are we going to support our patients, make sure that they have what they need, but we keep our staff and morale boosted. We make sure that we're organized, and we make sure that we can tackle the new year while it's going to be stressful, while it's going to be a just crazy time, how can we keep all that together? So it's a great way to set goals. Maybe it's, we're going to update our spreadsheets every day. We're going to update our spreadsheets every other week. So again, thank you for your time and listening in. Let's go to Q&A. I think that's going to be where the good stuff is.
Hey Liz, one of the questions that we have is, what are your best suggestions to find your specific field reimbursement manager for a product besides going through the hub? Because it's been a challenge for us.
Okay, so my favorite thing, if you can't get answers from the hub, typically you can call your manufacturer and you can ask, hey, I'm in this area. You can try reaching out on social media, just saying, hey, I need help. Can somebody connect me? You can reach out to NMAPA as well. We will do the best we can to connect you with someone. It may not be your specific representative, but you can reach out to us and we'll work through our channel of people that we know and try to get you connected to at least someone from that company, if not your person. But there should be, and they're not coming in the office right now due to COVID, dig around the office, dig around the facility. You probably find a business card from someone from that company at some point. Those are things that I do if I can't find someone. And then phone a friend. I track down others in my specialty on LinkedIn and ask, hey, do you have a contact for this? But I know the manufacturers they want to talk and they want to help. So we can try to connect the best way we can. Is there more, Amber?
So far there's not, but if anyone would like to talk or have a question, we can unmute you guys so you guys can ask it, because I know sometimes it can be hard to type in your questions.
Yeah, and if you have a suggestion, if there's something in the guide or in this discussion that we missed, something that works in your practice or your facility for end of the year, please, I would love to hear it. Again, this is stuff that's worked for us in the past, but that's what this community is about. Let's find what works and let's put it together. There's so many different sizes and styles of practices. The goal is to get it out there and open that dialogue.
Yes, and there's also one suggestion in the chat box that also says, like, you can reach out to your drug reps. So that's a great idea, Natalie, to connect with others in the manufacturers, to know if you have a sales rep or a drug rep coming in, they should know how to get you in contact with your FRMs as well.
That's a really good point. And I think it's a great opportunity right now to take advantage. A lot of these lunches that are happening is virtual. So there's 20 to 30 minutes of digital interface time with someone from that manufacturer, whether it's your sales, a medical science liaison, somebody. Step in, ask, say, hey, I need some help. Can someone please contact me? Use those times wisely. I think they're great.
We have another question. So as we are preparing for the beginning of the year, do you suggest treating patients the first week, or should we wait a little bit longer? I know this is always a challenge, so I just kind of want to see what your opinion on this is.
I am a fan of not interrupting patient treatment or patient therapy. So if their dose or something falls that first week of the month, I am for seeing that patient. Where that can be difficult is, again, with eligibility, authorizations, and things like that. So going back to that 2 days rule, checking things 2 days before, that last week of December, if your practice is open, I would reach out to those patients and I would call and say, hey, do you know if something's changing? Do you know what's going on? And kind of open that communication ahead of time. But that's how we function. And again, that can be different for everyone else, but I'm pro first week of January. Watch now, I'm going to be crazy busy that first week, but I am pro January 1.
Are there any other questions? Does anyone want to chime in? I will say that this is being recorded, so it will be posted online for you guys to go back and look at and have this information. You can also give us any feedback and let us know like how, if there's any questions or anything like that, please feel free to let us know. Liz, there's another question that came in.
Okay.
Do you utilize any portals to help you with blizzard season? And that also includes like foundation portals?
Yes, I do. So I use obviously the manufacturer portals, copay card portals, all the different ones. But at the same time, I go to the payer websites as well, double checking if it's a patient, say, coming that first week of January, using what resources are laid out in front of me. I have Reverification coming next week. My team and I are working on something, and it's all through the manufacturer's portal. So that's a big help for me.
Perfect. There was just a suggestion in the chat box that I would like to read. It says, as a patient support manager, reaching out to us is definitely the best way to help. Some companies have restrictions on in-person visits, so virtual meetings are always encouraged. So just an FYI for attendees on the webinar. A question from Wayne. Oh, go ahead.
Yeah, I was going to say on that, connecting with your manufacturer and your representative, I kind of want to throw out too, for anybody from industry on the call, sometimes, you know, people change jobs this year, people were let go. If you haven't heard from that office, or I'm sure you guys are reaching out, but reach out to your point of contact. Make sure going into this season that they've heard from you. If it's a hospital facility, make sure someone at that hospital facility knows. I think that's where a lot of disconnect happens, especially in the larger practices and facilities. So yeah, let's work it from both sides.
Perfect. So Wayne would like to know, do you front load your Medicare fee-for-service patients in January?
No, I do not. We leave everything as is. He texted me that question too. Sorry, Wayne, I didn't answer. No, so we keep everything as they come in. And I will actually, let me kind of go on further with that one. For our Medicare fee-for-service, one thing that we do to kind of highlight to them is that we don't know exactly what their supplement plans cover as far as when it comes to medications and all that. We try to give them the most benefit information we can. But if we don't have whether or not their plan G covers their deductible, they may have to owe at that time. So we are transparent with that. But most Medicare patients, they usually realize yes or no if they have that deductible to meet.
Great. So how should manufacturers be interacting with facilities as we navigate COVID and all of the other things that are going on this year?
If it were me, what I would do in that situation is I would look at the contact I have for that facility, and I would attempt to make contact with that person. And if they don't respond, don't answer, I would call the facility, call the pharmacy, whatever it is, wherever your connection should be, whatever department, reach back out. I know that I have patients that go to various hospital systems in my area, and when my point of contact leaves, I end up calling HR sometimes and saying, hey, I need a contact. I'm calling from, such and such practice. I need a contact in this department. Can you help me? And sometimes it's not a blind call that way. They're connecting me internally, and that's nice. If that's not the case, if you don't have that kind of opportunity, there's always someone who can answer, whether that's a receptionist, someone in admin, someone in medical records. Reach out. Billing, these depending on what your job role is in industry, someone there can connect internally. And I will disclaimer that I don't work in a facility full time, so that is not my area of expertise. That is just what I do to get in touch with my points of contact through a facility. if that's it, Amber, we can give everybody back some time on their Friday morning. I know this is usually a really busy time for meetings and things like that. So, and with it being the last day of the month, I know that there's a lot on everyone's schedules. So,
it looks like we had one question come in. I'll answer that one real quick. If there are any additional questions, please feel free to reach out to us. But the last question is, what is the best tip suggestion to give feedback on what's working, what's not for our manufacturer recertification process?
The best way to give feedback?
Yes.
I'll speak from my perspective first, and then I'll talk about kind of what I've learned. With my points of contact, I'm very involved. As a matter of fact, I'm meeting with my FRM today after this to talk about some patients. And I just tell her everything, what's working, what's not working, what I'm frustrated with. And they have internal channels. She's able to report up what I said, as well as communicate with others. I also will reach out to my sales reps and say, hey, I'm struggling. Can you get me in contact with someone who could maybe help with this? So that's what I do. I use what I have and I spread the message of this works, this is not working, I'm frustrated, I'm happy. They also like when you tell them if you like what they have and what they've offered. And if not, there's contact numbers on the manufacturer website, on the portal. There are, you can email, you can call the hub services. There are lots of ways to get back in touch with them. But I recommend starting with your closest contacts and letting them know how you feel, how it's working. And a lot of times those suggestions and those, hey, this would be better, they take those seriously and they bring that back and they have teams that talk about it. So don't ever be afraid to tell them if you like something or don't like something. I think a lot of us in our advocate stories and how we've gotten to where we are all started from running our mouth about something. And then it was, well, tell us more, let's talk more. And you kind of build that relationship with a manufacturer that way. True story, that's kind of what happened for me.
Perfect. Well, we would like to thank Liz for your presentation this morning and for everyone attending. Always feel free to email us at info@namapa.org and we will be in contact soon.
Thanks, everybody. Have a great Friday.